This documented case will cover a maxillary single arch FP3 guided smile surgery in a standard protocol. The records for a dentate patient are as follows: photographs per the checklist, master impressions with all the land areas, either digital or analog, and then a CBCT scan with the teeth apart, the patient biting on cotton rolls or biting on the stick bite. The checklists are available at GuidedSMILE.com, and we have a checklist for many of the different situations that present. So just simply print them off and have the team follow top to bottom and capture all the necessary records, and it will help us be successful and meet you online as fast as possible. Once we have all the records, we do a little case analysis. We articulate the case. We, if needed, do a little back and forth with your office. Otherwise, we just book a time to meet online, and you'll meet live with one of our experienced planners. And in about 15, maybe 20 minutes, we have tweaked and finalized the case to your 100% satisfaction. And then we send the package off to surgery. So let's go through this case. This is, as we mentioned, maxillary single dentate. And what that means is that the first thing that you'll do, the first part of the procedure, is you'll seat the pin guide with the fixation base or without, and you'll make sure that it seats, and you can see clearly in the windows here that it's seating on the existing teeth or on the tissue, depending on how the patient presents. And as long as it's seating without any rock, then it is removed, and then the tissue is flapped apical to the fixation base. And once you have a full flap that goes all the way back to the terminal part of the fixation base, then you reinsert the pin guide connected to the fixation base with these chrome locks. There are 3 of them. And hold it firmly against the teeth of the tissue. Have a team member do it through the whole process, through the pinning process. And you'll notice on the surgery mat, which is on the wall, this is a 47-inch long mat that you tape to the wall, and you'll see here that all the pins on this patient are short, and you'll see that's reinforced here with short, just to confirm, because sometimes they're long, sometimes they're short, depending on the thickness of the patient's bone. And the short drill will be drilled on some maxillary, so you probably want to stop a millimeter short, and then place the pin, drill a millimeter short, place a pin, etc. 4 times, and then while holding the pin guide firmly still, use a surgical mallet and tap the pins until they touch the metal, and then you're at full seat. And once seated, then you will extract the teeth, and you'll adjust the bone down to the top of this fixation base, to the coronal part. This is a bone reduction guide. And you can notice here that the guide is floating. It's floating guide technology. And in the image on the surgery mat here, you'll be able to acknowledge visually that the fixation base is in the right spot. Just look up at the wall, look in the mouth, and confirm that it is seated properly. And then once you've reduced enough bone down to the level, then you'll try in the carrier guide. The carrier guide serves the purpose here of just confirming you've reduced enough bone. Sometimes it's a little difficult to see in the back of the mouth, but you'll see that the only thing that can hold the carrier guide up is tissue or bone. And so just do a little bit of analysis, and if you have to, go back and adjust more until the carrier guide seats passively, and you'll plunge in the chrome locks here. And if it's passive, then you move on to, you can see here the bone's reduced. Then you move on to the osteotomy guide. And in this case, this is the patient has 2 straights and 2 angled here in the posterior. And you can tell the angled sites because there are little nubs on the sleeve that show the indexing for the Nobel driver. Right, so you'll rotate until you're at depth, and then you'll just stop rotating for indexing the rotation of the implants. The SurgiMat will give you the indication of the platform. As you can see here, RP. It'll give you the implant size, the implant position, cross sections of the location of the bone, and then you'll see also there's a little red line here that shows the relation of the implant to the bone reduction line. So a lot of good information here that's, again, on the wall at a glance. And you can also see the osteotomy guide seated here. And the team would have already placed all of the implants and components on the SurgiMat on the counter. So implants, abutments, temp cylinders. So all you have to do is go to the counter and grab your parts and implants like a grab and go. All right, so all the instructions are there. So the implants, and we won't go through the drilling or placing of the implants in this video, but we will show this part of the carrier guide. The carrier guide, maybe you noticed before, had little notches in it, and the notches indicate the trajectory of the implant, the abutment screw, and the driver. So this way you'll know which way the abutment goes in on an angled site, right? So as long as the driver is going through that little notch, then you know you're in the right spot, in the right rotation. And then the anteriors on this case are straight, right? So there's no notches here, right? So that's just an aid in indexing abutments. And then once you have all the abutments in, then you will add temp cylinders. You'll add a temp cylinder to each abutment. You'll put you'll seat the prosthesis to make sure it seats passively. Then you'll come back and you'll add gaskets around the temp cylinder to sleeve it right down to the carrier guide. Then place a plug in each of the temp cylinders and then backfill with this stellar material from Taub. It's what we recommend, light cure, dual cure. And you'll just simply backfill the void between the temp cylinder and the prosthesis. Right? And just verify that you have material, hopefully 360 around the temp cylinder. And then just simply hit it with a light to cure the resin, pull the plugs out, unscrew the prosthesis, perform this a second time with the rapid appliance. Right? You always do 2 pickups. The first pickup is the aesthetic one. The patient's going to wear that home. The second one is the rapid appliance. The patient will wear that one home when this one is sent to the laboratory in 5 months to go to final. And that way the patient always has a prosthesis and the laboratory has a great record to go to final. So you'll just send it with a bite and a posing. The restorative doctor will. And a wash impression. So wash, bite. It's already equilibrated. It's been in the mouth for months. And then a posing model and some photographs. And you can go either right to final or complete a prototype. So on the day of surgery, you just simply remove the prosthesis, just clean up these areas here. You can either do a standard large hole conversion or you can do a small hole. That's available too. You can watch some videos on that. And then just simply take it back in the laboratory, fill the carrier guide peg holes, and then just clean the material around the temp cylinders, backfill any holes, and deliver. And that is a maxillary FP3 standard chrome guided SMILE protocol using Nobel BioCare.